that was literally the most painful thing I have ever experienced. My worst fear in regards to this. But now I know that I'm always going to have this pain for my whole life. Sorry. I'm sorry. Hey guys, it's Angel. Welcome back to my channel. Today I got some news. So this is going to be kind of a serious video. Alright, so you might remember a couple weeks back I had a storytime video all about a recent trip to the ER where I literally thought I was going to die. Like, I thought I was having a heart attack or a pulmonary embolism, something like that. I had severe chest pain and went to the ER. It was very, very scary and very, very painful, and did I mention very, very scary? So when I got home from the hospital, I filmed a video, updating you guys on what happened. Now, when I was editing that video a day or two later, I researched the tests that the doctor had ordered, and when I was looking at those tests and what they're for and what the results I got meant, and just coupled with different symptoms and things that I have been dealing with for literally years, a light bulb went off and I realized, especially because my diagnosis of pleurisy is not something that just randomly happens to healthy people usually. So if you want to know more about exactly what those tests were and all that, I'll put a link in the description and also up in the cards for you to go watch that video if you didn't watch it. Anyway, all of those things coupled with family medical history of people in my family, both of my parents, a couple of my aunts, a couple of my cousins, had me very concerned that perhaps I was dealing with an autoimmune issue. Now, I've had a very, very chronic lower back pain since I had my son, who is 5 years old. He turned 5 back in November, and all this time I kind of suspected that it was caused by the pretty much botched epidural that I got during labor with him, because when he was placing it, it was extremely painful. It felt like someone was stabbing my spine with a knife, and my back pain started to be, I've always had some amount of back pain my whole life actually, which I always thought was related to some car accidents I was in as a child, and I could go on forever about all this stuff that makes so much sense now. But I had always had some back pain, but it really got much more pronounced after that. And especially the pain originated like right where that epidural was. Like, my husband could see the mark of where it was placed, touch it, and that was exactly where the pain was coming from, or so it seemed anyway. But of course, my 6-week appointment, the doctor kind of blew me off, like, oh yeah, you just had a baby, it's totally normal to have back pain. Now, I'm the kind of person, I don't always take very good care of myself, especially since I became a mother, and so much of my time and energy is spent taking care of my child. Now, I have 2 children now, and there's just so much on my plate that I kind of put myself on the back burner, especially because as far back as I can remember, I've always been dealing with pain and fatigue and just certain issues here and there, getting sick often and whatnot, that I'm just used to not really feeling very healthy most of the time. I don't always go to the doctor nearly as often as I should. It's definitely on me that I let it slide for as long as I did. I actually didn't address it again until I was 8 weeks pregnant with my daughter. And the ironic thing is I actually originally went to the ER for an entirely different reason. I actually thought I was miscarrying her because I was bleeding. And while I was there waiting in the waiting room, my back started to hurt more and more and more and more. So by the time the actual doctor came in to see me, I could barely move. I was in excruciating pain, and they thought that the pain I was talking about was in relation to the bleeding and cramping. They addressed the reason I was there. They took an ultrasound. Her heart was beating away, she was healthy. They couldn't explain the bleeding, especially because I was already on progesterone. So they just sent me on my way, and I was like, I can't even stand up. Like, how am I gonna go home? Let's just say Naval Hospital in Portsmouth, Virginia leaves a lot to be desired in a lot of different ways. My husband was at work that day, and he was upstairs working. He was finishing charts. He worked in a day of surgery at the time. So they called him and told him to come down and help me get to the car. Then they brought a wheelchair, and he had to kind of juggle our son, who was not even two years old yet, in the stroller, and me in the wheelchair. They just kind of like left him, like they didn't help him. It was weird. And I sat in the car until he got off work so he could drive us home. So it was really bad. That particular flare-up, I literally could not stand up for almost 2 whole weeks. It was not only excruciating pain, but like I physically could not. Like even if I wanted to push through the pain, my spine just wouldn't do it. And my muscles started spazzing a lot, and it was terrible. Honestly, I've had kidney infections, I've had 2 births, both of which I went a very long time without an epidural. I have been through a lot of very, very painful things in my life, and that was literally the most painful thing I have ever experienced. It was so bad. So I went to urgent care about a day or 2 later. Please help me, I can't even, like I couldn't even sit in the wheelchair. I had to lean so far forward because it hurt so bad. And because I was pregnant, they didn't really want to do anything. They're like, well, we can't do x-rays, we can't do MRIs, we can't really give you these like, you know, sorry, you're pregnant. She ended up giving me a little bit of Motrin and a little bit of Percocet, and she really shamed me and guilted me about that. And I'm like, okay, I'm like in totally excruciating pain right now. Pretty sure that's not good for the baby either. What the doctors did didn't really help. I went to a chiropractor again, and I had to go 3 times a week for a week and a half before I was finally able to stand up again. And it was a couple more weeks before the pain dissipated back to what is my baseline. Since my son was born, I've literally not had a single day without pain. There's always pain. A good day is a 2 on the pain scale. That's a good day. Most days are about a 4, sometimes a 5, and then I have flares, big or small. So typical flares are around a 7 or 8, and then occasionally I have ones that are very bad and I can hardly move. So we left Virginia, we got down to Florida, and then, you know, things are really hard for me every time we move anyway. It takes me a really long time to feel settled in and ready to like resume normal life. So again, I put it back on the back burner because I was starting to feel better. Not better, but just my normal that I had come to know for a couple years at that point. So I let it slide again, and then I had my daughter, and I ended up with an epidural with her, which was fine. It didn't hurt, it worked, it was great. I had another flare-up that was pretty bad. I went to the urgent care they had, got a shot in my back, and then she ordered lidocaine patches and physical therapy. So luckily Justin's command at the time was very flexible and great. They had no problem with him getting off work early for me to go to appointments that they needed so he could watch the kids and I could take the car. Physical therapy is not an appointment you can take kids with you. So I went twice a week for almost a year. Well, it did improve my overall pain level and my, you know, mobility and just my quality of life. It got a lot better, but still only so much better. I plateaued, and then we were about to move again, so it was time to stop. And that was a year ago. And it's definitely gotten a little worse again. It's not as bad as it was before the physical therapy, but it's not much better. So I had the pleurisy, and I had the concern about autoimmune, and then hey, I also have this back issue, and at the time I thought they were unrelated. I went to my primary care doctor here in Washington, and he was very receptive to just tackling this. For some reason I chose him, and I'm so glad I did, because he's exactly the kind of fit that I needed. I need a doctor who doesn't hesitate to run tests that are needed and put through referrals that are needed. Also, doctors that follow through. Because he told me, okay, I'm gonna do all this blood work, and I'm gonna do x-rays of your spine and your pelvis, and I will call you if something is wrong. And so often in my life, I've had doctors say they will call me, and they never do. So earlier today, my husband got home from work, and I literally was just saying, I wonder when I'm gonna hear back from him. It's already been a whole week. Not even a minute later, I'm like, I was seriously like, whoa, did I just have like a psychic moment? It was weird. My phone started ringing, and it was my doctor. So another theory that he had was Lyme disease, and that's also because I have this psoriasis here, I guess is now what is the conclusion. He had a theory because of some of my symptoms and because of that maybe it was Lyme disease, especially because the most recent place that we lived was Rhode Island, and it's a really big problem up there. So he ran tests for that, but he also wanted to run tests for autoimmune stuff and the x-rays to see if he could see any arthritis or just, you know, see anything that would point to why my back hurts. Because all this time, all these years, no one has ever done an x-ray, no one has ever done MRI, nothing to try to actually figure out what was wrong with my back. We knew it hurt, but nobody knew why, and knowing why is kind of important to figure out how to fix it, right? So he said it's not Lyme disease, but one of the things did come back. He said HLA-B27 was positive, and that, coupled with what the x-rays looked like, coupled with my symptoms, was conclusive with a rheumatoid arthritic type of condition, which is not rheumatoid arthritis and is not lupus, which lupus is kind of what I was leaning towards because that seemed to fit the best, and that's what my dad has. It's something that he said is like a cousin to the two. It's similar, it's related, which is called Ankylosing spondylitis. It's a $4 word. So what this is an inflammatory condition. There's inflammation in my spine and pelvis primarily, but it also can eventually go throughout your body, particularly the hands and feet. And I do have a lot of stiffness and pain in my hands and wrists, especially in the morning. A lot of times in my ankles, which again I attributed to a lot of ankle injuries I had as a kid. But most of the pain is in the sacrum and the pelvis, which is exactly where it hurts the most for me. The inflammation can eventually cause your spine to fuse. There's the inflammation, and it also is an autoimmune problem. So it can cause gastro problems. It also can cause problems with the lungs and the heart. So there's where the pleurisy and the pericarditis fits in. If there's issues with ribs hurting, that can also make it hard to breathe. So just what I need, because I have asthma. Causes inflammation in the eyes. You get a lot of dry eye and irritated eyes, which I've been noticing more and more over the past few weeks. I mean, it's an autoimmune problem, so it affects a lot of your body. And it also can cause psoriasis, so that's why that's there. Luckily, it doesn't usually affect someone's lifespan. However, it does increase the risk of heart attack and stroke, which is scary, I'm not gonna lie, but I kind of expected that I would be at increased risk of both those things because they run in my dad's family, which of course they do because my dad has lupus. The HLA-B27 is a gene that they're pretty sure is something that's like an epigenetic, like some trigger for this condition. When they test people, like something really high, like 90% of people that have this condition have that gene. So it really points to like the correlation that it is something that drives this, that is causing this. They're not really sure exactly what the event is that triggers it. There's theories that certain bacteria will do it. So the game plan for now is he prescribed Celebrex that he wants me to take daily. It's less risky to take long-term than naproxen or Motrin. He also put in a referral for me to see a rheumatologist. He asked me a bunch of questions about my fatigue levels and my pain levels, so we have a baseline. And he also suggested physical therapy, but I don't know if that's logistically possible with my kids. We have one car for now. We're hoping to get another car this year or next, but still I can't bring my kids with me to the physical therapist, and it's like twice a week at least. I don't know if they'll work. He's on a ship now, like he's not able to leave as much as he used to be able to, and he has duty, so he's gone for like almost 48 hours every single week. So the logistics, I just was really concerned and upset that I don't know if I can actually do that, even though I know it would be beneficial and important, that I don't know if it's actually feasible to do. So for now, I'm just going to try to do the exercises and stretches that I know from my previous physical therapy, and it's something we can readdress when I see the rheumatologist, or you know, if it's not helping or things are getting worse or whatever. But I'm not gonna lie, I've been really emotional about this all day. As soon as he hung up the phone, I started crying, and I just cried more and more. And at first I didn't even know why I was crying. I just had to kind of talk it out with my husband, who, bless him, he is the best husband. I don't know what I would do without him. He is the perfect partner for me. So I talked it out with him, and like I finally kind of realized like why. On one hand, it's a really huge relief. It's like a feeling of like vindication of, I don't know, it's just helpful to finally have a name for it, to finally know what's wrong, like why this is happening, just at least to know. It's also nice to feel validated that like, no, I'm not exaggerating things, I'm not making this up, I'm not imagining this, like these things are happening to me and I'm very sick, like something's very wrong, and I was right, something is very wrong. On the other hand, it's very scary to know that this can cause some very serious health problems for me on the long term. It also really sucks that my worst fear in regards to this, you know, I've always been afraid that I'm gonna have this for the rest of my life. And I remember talking with my physical therapist, like, am I gonna have this for the rest of my life? Am I gonna always be dealing with this? And he was like, no, we'll make it better. But now I know that I'm always going to have this pain for my whole life. And at this point, they're not gonna really be able to make it better. It's really more that we're going to try to prevent it from getting worse as much as we can. And I know that we're only going to be able to do so much to that as I'm aging and time goes on. It's just going to be progressive. It's a progressive disease that not only causes more and more pain, but also as more and more fusion happens, it affects your mobility and the flexibility in your spine, being able to bend and twist. Just very basic movements will become difficult and even maybe eventually impossible for me. And just the implications of that when I still have small children and we kind of want to expand our family, and you know, we've been talking about that a lot lately, but we haven't been sure if that's doable. Kind of dependent on if he's able to advance rank or not, because not only is it another $500 a month, literally, it also means he would have the ability to re-enlist if he wanted to. If he can't advance before the next 2 years are up, then he won't be able to re-enlist even if he wanted to. It could be worse. I definitely recognize that. It could be a lot worse. It's something that can be managed, you know. I hope once I see the rheumatologist, I hope that will make me feel a lot better as far as being able to have a game plan, because like maybe it's been so bad the past 5 years because we didn't know what it was and we weren't really doing anything to manage it. And now that we know what we're dealing with and we can come up with a treatment plan for it, maybe I'll start to feel a lot better than I have in a long time. Maybe this will actually improve my life, at least for a while. And it's just so demoralizing to know that this is going to be a struggle for me always. Guys, it's been so hard. It's been so hard. It's hard to do anything. It's hard to take care of my kids and be hands-on mom. It's hard to take care of our house. It's hard to feel like I'm being a good wife. I feel like I'm not pulling my own weight enough. I feel like he's doing so much for us. He works so hard. He literally works 10 to 12 hour days, sometimes longer, not including his duty days. His job is very stressful. And then he comes home and he does so much for the kids and for the house and for me. Sorry. I'm sorry. It's just upsetting. It's upsetting. It's upsetting. Dealing with pain every single day. It just wears you down. It's just so hard to live with. So much pain. Like, I don't even remember what it's like to have a normal life and not have pain. I don't remember. I honestly, it was so long ago, I can't remember what it feels like. And that's hard. And it's just frustrating because I want to be so much more. I want to be able to get so much more done. I want to be more productive and capable for my household. I want to be more hands-on with my kids. Like, I can't even pick them up anymore, really. Or even YouTube. Like, it's hard to sit for hours on my computer editing. And sitting for prolonged periods of time is the most painful thing I do. Doing anything for a prolonged period of time is really hard. Walking around, standing, sitting, even laying down in bed. If I stay in one position too long, it hurts really bad. So it's hard to get to be on top of YouTube. That's why I'm like 6 months behind on our family vlog, because sometimes I just can't do it. I just can't sit there long enough to get the editing finished. And maybe the next day I'm in more pain and I'm so tired that I just don't feel motivated at all to do it. It's just hard sometimes. I have to dig really deep sometimes. So when I'm struggling just to like live, like basic things like feeding myself and feeding my children, when even that's a struggle, then everything else obviously goes to the back burner. And I have to, if I only have enough energy and just will to do the very necessities, then I just can't. That's all I can do that day. So I think I've gone on long enough. I just wanted to process some of these feelings because I've just been feeling very mixed emotions, very big emotions about this. This is a start of yet another journey, or I guess the continuation of one, but now with more clarity. I probably will make some videos about it on this channel, but not very many, because to be honest, it doesn't really fit in with the content I usually make on this channel very much. But definitely on our family vlog, I will definitely vlog about what's going on with it. If you aren't subscribed there yet, definitely go and do that. I've got a link in the description below for you to go over to that channel. Like I said already, I'm 6 months behind, so it'll be a while before this stuff is going to end up on there. But there's some past vlogs. There was ones where I vlogged after coming out of physical therapy. Like, I've kind of touched on it here and there. It's just another thing for our family to navigate together. I feel like now I can get more support. Now I can find my community of my people that have the same condition or similar conditions. I'm really looking forward to having that community of support. I think community is very important in life, especially having communities to help you with your struggles in particular. And this is definitely going to be a very big struggle for me. So I really appreciate each and every one of you. Thank you so much for watching. Thank you so much for all your support. Thank you so much for your time. Really appreciate it. Thanks for watching, guys. See you next time.